Well, good morning, everybody. Welcome to the final day of our private well conference for 2022. I'm Steve Wilson. I manage the private well class. I'm at the Illinois State Water Survey, and I'm actually going to give the first presentation. And so I guess what I'll say about myself is I'm a groundwater hydrologist. I've been at the Water Survey since I started as a freshman in college in 1983, so a long time. We have a new section. It's called the Environmental Public Health Information and Data Services section, which I manage, and that's a little bit what I'm going to talk about today. So let's pull up the presentation and get started. All right. So I'm going to talk about research questions in environmental public health. Really, this is about the water survey and what we do, what we've done historically, and how we want to move forward, looking at more questions at the intersection of water and public health. We have a lot of expertise, and I'll go through that. I do want to talk about our history. Most folks don't know who we are, even in the state of Illinois, unless they've dealt with us for some reason related to a well or flooding or some issue related to water quality. But we've been around for 126 years, and it's a really unique agency. Make sure I've got this moving forward like it's supposed to. There we go. So the Water Survey, as I mentioned, is 126 years old. It started in 1895 by our state legislature to look at cholera and typhoid and ecological problems related to water quality. And so we have a long history. I'm going to show a bunch of pictures today. We've got these glass plates that go back to 1905. And just like this is a hand pump in a community park from the early 1920s, I believe. But there's a cup sitting there, a tin cup, and that was there for anybody to use and to drink. Having those sorts of things was outlawed in Illinois in the 30s, I believe. And so we've learned as we've gone. And I'm going to show a bunch of examples of that today as well. Okay. As I mentioned, we start out looking at cholera and typhoid outbreaks. So there's a number of these kind of cases in our files. This is Pana, Illinois in 1916. It's interesting because we investigated why this outbreak occurred. They had a water treatment plant they just put in 1912, and it turned out they weren't using it because the mayor said it was too expensive to run. Only half the town was sewered, and so they had problems with even some of the dairy farmers nearby wouldn't complained because the cows wouldn't drink out of their creek because there was so much sewage. And so the Water Survey went down and investigated this, and it turned out it was the milk at the Pana Ice Cream Company. And if you've been on any of our webinars, you've heard this story, I realize. But it's interesting because it was neither the water or the wastewater system in this case, but all the milk from all the dairy farmers went into one large tank. Everyone used the same bucket to scoop it out, and it got tainted with typhoid. And so 32 people got sick in Pana over the course of a little over a month. So other examples, these glass plates I mentioned, this is a broken one. And this, I just find this slide fascinating, to be honest. They're investigating 100 and some odd cases of typhoid in Rockford, Illinois. And one of the things they did is they followed E. Erickson on his dairy route because they figured out it was the milk to see if that was where all this was happening, it was a question if it was the milk. And you can see over a period of 3 months, there were 7 or 8 cases there that were part of that. But that's the kind of work we used to do. Next slide. And then as this moved forward and typhoid became a little more of a known thing, we figured out that it's because of our sewage and unfiltered water and those things. So there's a number of examples where different communities in Illinois or around the country where we worked, where they installed a filter plant and all of a sudden they saw a drop in typhoid cases. Next slide. Just 2 more examples, 2 larger communities, Cincinnati and Chicago. One other thing that was interesting going through all this information was that Europe was way ahead of us. They had about 1/10 the rate of typhoid cases than we did because they were farther ahead in their water and wastewater treatment. And some of our scientists actually went over to different countries in Europe, Germany especially, and gathered information there. But you can see how adding treatment made such a difference. Next slide. This is something that we put out, and this is for a septic system. So you have a dwelling, a settling tank, which is your septic tank, and then a herringbone diagram of a line to remove the waste. And you can see the typical procedure was to have a wall, a masonry wall there with a valve, so that if it got full or plugged or whatever, you just open it up and it dumps into the stream. And this is the advice we gave folks in the 1910s and 20s. And so it shows where we were and where we've gone since then. Next slide. As well as wastewater treatment, we helped design a lot of the wastewater treatment systems in the Midwest in the early 1920s. This is Lake Forest, Illinois, which is a wealthy Chicago suburb on the north side. This plant was, there's a septic tank and then the filter beds, and you can see it's right on Lake Michigan. No accounting for surge from a storm, no accounting for anything else. And the sand infiltration obviously is connected to the lake. One of my colleagues who's retired now, when he was a kid in the 70s, said that this facility was still there. It wasn't in use, obviously, but all the remnants were still there, and they used to play down there all the time, which I thought, yeah, anyway. Next slide. This is leading somewhere. So these two slides, the one on the left are systems in 1924 in Illinois that had some sort of filter treatment on their wastewater system. And on the right, and there's 72 of those, by the way. And on the right is all of the systems in Illinois that were still dumping unpurified sewage straight into streams. And there was 136 of those. And so even in 1924, which we were starting to move into all this and understand it better, and we got typhoid under control, was still an issue. And it took a long time before a lot of this was actually rectified. And we saw communities like Milwaukee, Wisconsin, where they actually had their sewage drop within a few hundred yards of their intake in Lake Michigan for their water. And so they had a huge problem for a while, and they moved their intake out a mile, and it solved the problem. Next slide. So we moved into, this gets into the early 30s. This is our anaerobic fermentation setup that was near the campus at the U of I, looking at biogas and some other things. We started looking at how to use wastewater, there we go, to our advantage, if you will. And it got us into the research side of things a little more. Next slide. So this is Tom Prickett. So it turns out the equations for groundwater flow are the same as the equations for electric flow, K = CIA. And so you can use an electric analog model and put voltage through it and measure the resistance and other things and determine how much drawdown or how much water level change there is. And so this was a pioneering effort. The model that's behind Tom is actually in our conference room, and we actually got it working again. And so you can go in and put a voltmeter on a couple places and turn it on basically, and you can measure drawdown, and that's in the Metro East, which is the St. Louis area on the Illinois side of the river. Tom, when Russia opened their doors to American scientists in the early 80s, 7 were invited from all kinds of fields, and Tom was one of the 7. And it's that important, groundwater resources, and they understood that then. And so it's it's interesting. He developed the first digital flow model as well. It's called PLASM, the Prickett-Lundquist Aquifer Simulation Model, which I was fortunate enough to use when I was a grad student. Anyway, next slide. But those are the kind of things that the Water Survey does. And I just wanted to mention that. And so what we are, we're like a state geological survey. They're our sister agency, in fact. And we were a state agency until 2008. And now we're part of an institute, the Prairie Research Institute, which is a department on campus at the U of I. So we're no longer state employees. Technically, we're university employees, which in a sense is, but we're sister agencies with a state geological survey, natural history survey, archaeological survey, and an organization called the Illinois Sustainable Technology Center, which does a lot of work on emerging contaminants, solid waste issues, reuse, all that sort of stuff. And so then our sections at the Water Survey are groundwater, watershed science, which is the surface water group, CHAMP, which is a coordinated hazard and a mapping program, which does, they're a FEMA partner. We do a lot of flood mapping and modeling of flood events and what's going to happen or what does happen. Our climate and atmospheric science section in HEAL is our lab, health and environmental associated lab. So we do applied research, data collection, and public service. So obviously the private well class, next slide, is on the public service side. We have observation wells. We collect a lot of data. On the research side, we do regional water supply planning for Illinois to help stakeholders in local areas understand what their resources are and as they grow. Groundwater modeling for both quantity and quality. And we also do contaminant studies and look at groundwater availability. For the public service side, we do have a public service lab within HEAL. We also handle several thousand data requests every year from stakeholders in the state, things like the private well class and wateroperator.org, which our team runs, and then public outreach. We do a lot of events to teach people about their wells and groundwater, and among many other things. We also house the state's well logs. So we have about 450,000 well logs on file for the 750 to 800,000 wells in use in Illinois. And that's actually good for many states. Compared to many states, IWIP is the Illinois Water Inventory Program, which every high capacity water user in Illinois has to provide their water use to us annually by law. And then we have observation wells throughout the state that we both take water level measurements and monitor that versus climate information, as well as water quality. And our lab has been around long enough. We've got over 30,000 water quality analysis for wells in the state of Illinois. Next slide. So the reason I wanted to bring this all up today is we've started a new section. We're trying to get back into the environmental health, public health arena and use the information that we've gathered and become versed in to start looking at some of those issues, especially related to private wells. So this new section, environmental public health information and data services, really is an outgrowth of our private well program. You know, we provide CEs for sanitarians. We have a lot of partners who are EHPs, air sanitarians, and it's getting us to put more emphasis on health-related research. So it allows us to apply all of the expertise we have in groundwater, surface water, climate change, water chemistry, all of those fields, and put more of a public health lens to the work that we do. Next slide. So the priorities for our new section are really to continue the functions we already do related to data and information, and that's outreach, public service, maintaining well logs. There's new logs that come in almost every day, and then also leverage all the things that we are good at, climate research, research expertise on a number of water topics, and also the relationships we built with the public health community through the private well class and wateroperator.org, and then use that to conduct research to answer current questions related, again, at the intersection of water and public health. And so that's our goal. Next slide. And so what we hope to do is we just started this section in October, and we hired a first EHP, Natalie Kerr, who's going to speak later today about some of the work we've started. I don't want to steal her thunder, but we've started a project looking at Legionella in homes with private wells. And it's a really interesting story how we got on that road, but it really started with a question from a well owner. And so that's the kind of work we hope to do. And so we're also, we just found out last week, we've got funding through a U of I program to sample 75 homes in an area near Chicago where it's considered an EJ community, and not only take samples, but provide outreach, work with local stakeholders to identify a champion, someone that we can work with that will have some weight and clout with the folks in that area, and use it as a test case, so to speak, on what we might be able to do in other parts of the state and the country. So the other thing that we have going on, and the pandemic really sidetracked us. Those of you who participated last year may remember Dr. Carolyn Murray gave a presentation on the first day, and it was about the work she's done working with pediatricians to see how the idea with her research was to offer test kits to mothers with small children on private wells. So they went to 11 local clinics around the state of New Hampshire, and they had, in some cases, the office staff or the nurses provide the kits, and in other cases, having the clinician, the pediatrician, and they saw a big difference in whether people actually returned the kit and actually did the sampling. And it goes to the fact that people trust their doctors a lot more than other folks from the government or wherever. And so we're hoping, we were going to go down this road to do the same type of work in Illinois with 3 local hospitals that are in rural areas. Oh boy, I apologize. I forgot to turn off my phone. How about that? And then the pandemic hit. So Dr. Murray has been, obviously, most medical professionals are pretty busy with and EHPs as well with the pandemic. And so we haven't been able to get started on that work. But the other side of this is we believe that a lot of doctors don't really know a lot about private wells. And we think it's really important that they do. And so we've worked with some other folks, and one in particular, Boston Children's Hospital, who agrees that we should try to go down this road. And we're working on developing some curriculum that will give those clinicians continuing education credit. And we hope to actually do a first class this fall. And so those are some of the things that we've started doing. And next slide. And so what we want to try to do is look at ways to move the ball forward and continue to do that. You know, we've discussed over the whole time the last 2 days about how well owners and also stakeholders don't necessarily understand all those issues and how do we reach them. And so one of the things I wanted to bring up was collaboration. I see this as one of the biggest issues we have, is that we need all parties at the table to solve some of our biggest private well issues. And I keep seeing where one group goes about doing it their own way and another group goes about doing it their own way. And there's, you know, in all honesty, there's good and bad in every profession. And I've honestly, because of my role with the private well class, you know, I mentioned realtors, labs, drillers, EHPs, and extension. I can give you both good and bad stories of a particular one of any one of those professions that I've dealt with over the last 8 or 9 years since we developed this class. And to me, the idea is we need to find the ones that are that are interested and are active, and developing those partnerships and including all those voices is the best way to move all that forward. Next slide. And so we even have cases where some of the funders only want to fund certain groups, when a more collaborative approach would make things better for all of us. And so the solution really is to find the good ones, or the good guys, if you will, so you can create a successful program and work within each industry then with those partners to improve their industry and those issues. And I know a lot of folks pick on drillers, and I've certainly ran into some drillers who aren't informed and who maybe aren't doing everything the right way related to disinfecting a well or some of those things, but it's just because they haven't been instructed on the right way to do those things, and we haven't reached out well enough. But there's also a lot of really good drillers who do get all that and are doing some great work. I work with a driller in the Chicago area who spends most of his time solving hard disinfection problems with biofilms. And he probably knows more about biofilms than any of us. And it's someone I've tried to get on this conference the last 2 years, and he always doesn't have time or something comes up, but we will eventually. And so I just want to point out, though, that when you look at successful programs that are really making a difference, I think they're all inclusive. They all listen to all opinions. And, you know, sometimes it might not be the easiest solution, but it's the best solution in the end, because when you come to compromise then and find those issues, you've created buy-in from all of those industries. So that's all I'll say about that. Next slide. So basically, I'm asking for your help. And I put this up. This was on one of the slides. This is from like 1908, this picture. And it's obviously something that the water survey folks at the time were struggling with, how to determine when it was safe to put sewage in a stream, which we all know today is not a good idea and can't be done. We've limited that, but I still don't figure out this equation. I've looked at it a dozen times. It's pretty interesting. So what we would like help with is, what should we do? I mean, what are our most pressing research issues? in terms of how do we improve the public health of private well owners and others on water supplies. And what about, and also not just research questions, but also in terms of educating not only private well owners, but the professionals that work with them. I think that's one place that we really could do a lot of improvement because we're all working in our own bubbles. And I think if we could kind of cross-pollinate that a little more, and like from my role, I see I need to spend more time working with some of the other associations and giving talks at their events on what we have learned and why they need to be collaborative and not and those things. And also, my goal is to conduct impactful research that provides advances as directly as they're completed. And a good example of that is this Legionella work we're doing through our partners that we've developed and folks that have reached out to us, and we've reached out to them to learn more about it. We hope that we've created a nice work group that eventually can share all their information with everyone in not too long from now, hopefully. Next slide. So, for example, here we go. From the conference this year, the first 2 days, here's 3 things that I put down as key for us moving forward. We need to find local solutions. So our work should focus on how to find and create local champions. That came up in the Zoom mastermind yesterday, who are trusted in local areas. And that in the end, local folks trust local champions or people they trust in their area, whether that be a water operator or the clergy or whoever it might be. And so we need to figure out ways to reach those folks so that well owners are more apt to listen, like to their clinician. The other thing is we need consistent rules related to private wells, well construction, testing, all of those things. And when you start, we heard from Massachusetts yesterday about every health district, which there's 351 in Massachusetts, can set their own rules. That's not, to me, it's not equal health protection under the law. And I think if we're going to create rules, it should be fair to everyone and no one should be left behind. And along with that, provide consistent advice. If you go out and look at pamphlets or information available about private wells, say for disinfecting your well, there's 100 different documents that all have 100 different things in it. We need to develop a way that we're all sharing information and it's all consistent, so well owners don't get a message or even a professional from one side and then a different message from somebody else, and then it leaves everybody confused and unsure. So it's a really, one of the other things I think we really need to look at and start trying to focus on. And lastly, partnerships are key. And what came up yesterday, again, was it's not just the well owners. They're hard to reach. They come from every demographic, all those sorts of issues, but also our leaders and those in charge. We see so many places where it's because of local politics that things either aren't fair or folks aren't informed or there aren't rules in place to protect public health, and there should be. And so it's not only well owners and their attitudes, but also the stakeholders that work with private well owners. And so that's kind of where we're at. Next slide. And so what I'm hoping for, I wanted to go short on purpose and it didn't go quite as short because of those technical issues. But if you have any ideas or thoughts, we will partner with anyone. And that's not, we have plenty of funding. It's not about getting more money in here for us. We've got plenty of work to do. We'd have to hire to do any additional work. But what kind of things should we all be focusing on? And we should decide as a community, in my opinion. And so obviously PFAS is hugely studied these days, and there's so much work going on. I mean, the literature is full of those things. We also have issues with environmental justice, marginalized and rural homeowners, and there's a lot of money from the federal government coming into those issues to try to adjust those and make sure that no one's left behind and that everyone has a fair chance at safe water. And then also we've heard about inconsistent or racially motivated rules. Jackie's talk on Tuesday was about an area there which they finally have public water, but it could have happened 40 years ago. And it's a shame that it didn't. So what I wanted to leave you with is feel free to share in the chat if you have any ideas or if you have suggestions for topics that you think are important for us or others to work on. We'll make the list available to everybody. We're not trying to, like I said, there's a lot more work that needs to be done than there are people doing the work to solve those issues. And so we should all be open to sharing and providing our data. I know, again, this Legionella work group that we're on, we've already provided the data we've collected to them. They've shared data with us, and it's helping us all learn from each other. And that's the kind of approach that we hope to take with this new section. So that's my last slide. And I'll take any questions. And and I don't see any, which is fine. If you have any thoughts down the road, please let me know. And thank you for your time. All right, here we go. One group that I'll put that up on screen, or I'm trying to use two things here. Sorry about that. Okay, so one group that may be getting left behind are the growing plain folk Amish populations in some states. In Wisconsin, our rules do not provide standards for their non-electric systems. Do any states you know of have standards for those? I've not even had that issue brought up, but it's a really good one. There's Amish in many states. We have, and it certainly is an issue for their water quality. If anybody else has any knowledge of that or any ideas, please speak up. Okay. All right. Well, we're going to move on. And so our next presentation is, okay, wait a second. I'm really quite interested in the work you've been working on with Legionella. Let me put this up. And biofilm. Our specialty is working with biofilm, the corrosion pathogens, bacteria, harbors. Let's talk, because I'm trying to learn more about biofilms and how, I'm actually supposed to go up with this driller and spend a few days, because it's a huge issue, I think, that's not being studied, as far as I think there's a lot more systems that have biofilms than people realize. Thank you, Lindsay. And Kathleen from Michigan said that wells must meet state well code in Michigan. And I think there's got to be some discussions there on how to respect their rights, as well as how to make sure they're safe. So